we have several C-section moms here. We have a few people who are supporting C-section moms. So we have the doulas and the National Black Doulas in the house. We have some supporting birth workers. So if you know this can be helpful for anyone, please click the share button at any point in the live. This is information that I don't see out there, right? You don't see out there, but it's so vital and it's so important, because there are mamas who are experiencing back pain, pelvic pain, and they're just thinking it's from me having a baby or it's from my epidural, which sometimes can be the case. It can be so many reasons for back pain, but one of those reasons can also be from your C-section scar, right? So if we're going to be talking about that, we're going to be talking about how it also is linked to pelvic floor dysfunction, pelvic pain, all of the good things. So let's jump right into, I would say, a more common one like back pain. Let's talk about how that can be linked to your C-section scar. So I don't know if we want to do just a little bit of a background about the layers and how the C-section is done and things like that to give that fascial connection.
Well, I have to. I think that we can exclude that information, because ultimately when you think about a C-section, we're going through multiple layers. We're going through the skin, the subcutaneous fat, we're going through fascia, we're going through the muscles. We're going through the rectus abdominis, right? That has to be teased apart. We've got the transverse abdominis under there. We've got some more fascia, the peritoneal fascia, because under the abdominal wall, then we have like the intestines. So we've got the peritoneal fascia. And then cleared all that stuff away. Then we've got the uterus, and it's all connected. I mean, if we've got restrictions in the fascia, then it's going to impact us not just locally, but it's going to impact us everywhere else. The other thing to understand is most people don't recognize that when you're going for a C-section, it doesn't take that long, maybe a couple of minutes to just do the C-section. Suturing takes
that's what takes a long time.
Minutes, because they have to suture layer by layer, and you have to have adhesion. So now let's think. If I am having adhesions, right, this is just my bony pelvis. So if I'm having adhesions up here where that scar is, right, everything is tight. Most C-sections, mama, tend to be kind of tucked over, because, you know, we don't want to extend. We don't want to. So hip flexors are getting tight. Now, these back muscles here, your hamstrings, your glutes, those are going to be overly stretched and lengthened, right? So now a tight muscle is a weak muscle. A stretched muscle is a weak muscle. It's not functioning in the entirety of its range. And now we're going to have weakness through the back muscles, right? We got the core because these muscles now are not being activated. And now we no support and stability comprehensively to the back. So now you end up with a lot of back pain. The other thing is you compensate, because if I'm hurting doing something, I'm not going to do it that way. I'm just not, right? And so now get into this habit of compensating, because, oh, well, I'm trying to be cautious. I don't want it to hurt, or maybe it is hurting already. And then that can just be the catalyst for consistent pain.
Exactly. So even with, so we talked about a lot, even in that one thing, posture, right, weakness. So that just really points to the importance of rehab, and we're definitely going to go in that. So if you all, hopefully if you're following us, you both know this is in that world of pelvic PT. That pelvic PT is well beyond just learning how to do Kegels. I'm leaking on myself. I go to a pelvic floor physical therapist. Like, there's so many other things that pelvic floor physical therapists do, and that includes helping you with your C-section recovery, all right? And that can be even before you have a C-section, so that can be planning, that can be a whole lot of things, okay? And so when you have a baby, a lot of people think, you know, I had a C-section, the baby came through my belly, so my pelvic floor is fine. Right? I didn't push anything out, right? That's such a, like, the hugest misconception. So, you know, we got to hit it. We got to hit it, okay? Because I think moms just don't understand, like, I didn't push my baby out, so why am I leaking, or why am I having painful sex, or why am I, why am I having prolapse? Like, all these other symptoms, right? But there's so many things that happen throughout pregnancy, carrying the baby. Your pelvic floor is an important part, so we don't let you jump right into that, because that's your jam. Go ahead and get it out, girl. Get it out. But you don't have soapbox.
Right? I'm going to say it again. A cesarean birth is not pelvic sparing. So if you have a cesarean birth, it in no way, shape, or form means that you cannot experience pelvic floor dysfunction. Here are the reasons for that. I'm carrying this baby. We're baking for 10 months, right? Essentially 40 weeks. We're baking for this length of time. You're carrying the baby full term. You're still going to have pressure on ligaments. you're still going to have pressure on connective tissues. We're still going to have downward pressure as baby starts to descend. And it depends on when you're getting that cesarean, right? Is this a cesarean, right? We might still have a baby that's turned head down and baby is descended cavity. So now we still have more pressure, right? So your pelvic floor is still feeling the weight of that. You know, biomechanically, you've also changed because, again, if I've got all this belly in front here that's pulling me this way, then I got my back arching back here. So we still, again, see the same tightening in the front, lengthening and weakness in the back. And so we still get all of those things that also can impact the pelvic floor because the big muscles around now aren't necessarily doing their job well. So it's kind of like I always say, remember back in school when we had group projects, right? And there's always a slacker in the group. So if the big muscles are slacking, then you've got to pick up the weight for those muscles. And that's what the pelvic floor is doing. So now it becomes overwork and taxed. So we can still pick up with pelvic floor issues as a result of that. The other thing is there are some people who have a cesarean because of things like failure to progress, right? Whether it's definitely failure to progress or not, that's a whole different conversation, but let's assume that that is the legitimate reason that is being used. So they were actually laboring, they were actually pushing. Now we've got to think, were they laboring for a long time? So a lot of stress and a lot of downward pressure on that pelvic floor. Those tissues are going to be stretched. Were they pushing? Were they pushing for a long time? I've heard stories of people who were pushing for 3-4 hours and then
and then they have to.
I mean, can you imagine pushing for 4 hours? Marathoners run a marathon in about 2 hours. The average regular person runs a marathon in about 4.5 hours. It's 26. Okay, that's a long. It takes me about 25 minutes to drive that on the interstate. That's still a long time. Can you imagine pushing 4 hours? I mean, for those of you who are here, some of you might have been through that. And then you got to go through a cesarean. So your muscles are exhausted. They are shot. They have been overworked. They have been overly stretched. They have been overly irritated. And so we still now can run into those pelvic floor issues now because of that, right? The other thing to kind of consider is when we think about things like prolapse. Prolapse a lot of times may not come immediately after you have had the surgery or immediately after you had a birth, whether vaginal or cesarean. So now on the back end of having your C-section, we have to think about the recovery. There is a surgery. It is an open abdominal surgery. The incision is probably about at least 5-6 inches, right? And we've got to be able to heal and recover. Those muscles are weak. So now we're dealing with muscle weakness, but because we live in the society we live in, we're expected to bounce back, get back to things. So now people more often than not end up doing things they have no business doing too early. Sometimes it's a matter of they have no choice, and I totally get that. If they have no support, then it's what it is. But a lot of the time still, they're doing things way too early. Sometimes it may be going back to work because they don't have the support or they don't have the time off. Maybe they work for a smaller company. All of these things have to be considered. And so now all of that stress on their body can then lead to things like your prolapse, things like your incontinence, and all those types of things as well.
Right. Right. So, and here's the thing is that we're not expecting you, at least in the pelvic floor physical therapy world, we're not expecting you to figure all of these things out yourself, right? That's why we encourage you to see a pelvic floor physical therapist locally. We have links, both of us have links in our bios where you can find a pelvic floor physical therapy in your local area. Dr. Juan, she is located in Atlanta, Georgia. So if you are in that area, definitely see a pelvic floor PT because as you can see, there's so many connections, right? This is your pelvis. But there's things that connect to the front. You have your core muscles, you have your back muscles, you have things going underneath. So if you have some issues going on at the foot, the knee, your hip, all of these things is connected, okay? It could be things even before pregnancy that you may not even thought about, but the way that you carried your baby, the way that you healed from your C-section, all of those things come into play. And so you got to address those things. And so we're talking about specifically the C-section scar, right? And so that scar is typically above here, or you have the vertical scar. But even with that, there's so much scar tissue underneath that visible scar that you have. And so those layers of scar tissue can connect to your bladder. It can connect to all sorts of things, okay? And so if you can think about the actual scar and then know that your organs are right behind that, that's why so many moms who go back and have C-sections later, and you ladies, let me know in the comments if this is your case, but you have repeat C-sections, and then there's so much scar tissue that they say that the actual scar tissue was adhered to my uterus, or it was adhered to my bladder, and then now I'm having frequency and urination, all these other things. So let's talk about maybe some of the other symptoms that people may have that they may think that's not related to their C-section, but could be.
I mean, there's also injury, which we don't talk about a lot, but there is the likelihood of bladder injury because there have is where they might have been injured or nicked as a result of the cesarean. Oftentimes, though, when we think about the scar, you have to think, again, we've got all those layers of tissue, right? Everybody heals differently.
Right.
Some people heal real fine. They can get a scratch and they're fine. Some people get a scratch and they have a raised scar, right? So part of it is knowing yourself, right? If you know that you're the that when you heal, you typically tend to have raised scars. That's something that's with your doctor, but you also want to find somebody early on to help you address this, right? Because you have people like us that can work with scar tissue. The other thing is this is a very small area. So let me pull out I gotta read. Oh Lord, I lost my vulva.
Lord, go find the vulva.
Vulva dropped on the floor, y'all. Okay, so if you have
that's in the major sense.
This is the bladder, this is the uterus. Look at how close it is. And this is a to scale pelvic model. There is not a lot of room in there. So when we have, again, that cesarean scar sits right here, that kind of bikini line, if you will. And the uterus sits right kind of here, and the bladder is here. If we've got a lot of scar tissue, it can adhere to those tissues. It stops the mobility of the uterus. It can stop the mobility of the bladder, so it's causing a lot of restrictions. The bladder is smooth muscle. It's supposed to fill and expand, and then when it empties, it goes back down, right? If it's not being allowed to fill, well, guess what? That's going to cause the nerves around it to go, oh my gosh, what do we got to do? We got to empty. And then you might start noticing things like urinary frequency. Why am I going to the bathroom all the time? I can't hold water. I can't hold anything. But again, that bladder now does not have the ability to expand in the way that it needs to. Okay. Right. The other thing is if we've got scar tissue, it can be irritating. So if we've got irritation, again, this is a very small region. If we have got irritation, it doesn't say the nerves in the area that are irritated don't say, you know what, we're going to keep this to ourselves. Y'all go on ahead and be spared. No, it's like being in a toxic environment where everybody, like my grandmother used to say, misery like company. So when one set of people are miserable, everybody must be miserable. And that's really, there's a lot of this crosstalk from the nerves. And so now you have irritation throughout the pelvis as a result of this because of the scar tissue adhesions and so on and so forth, which now can also get into bowel issues because, again, the bowels are right here. They're sitting in the back of that uterus, right? Again, not a lot of room. We also have the pelvic floor muscles themselves. So when you go ahead and you remove the organs, now I'll keep my rectum and my bowels in there, but you can see the pelvic floor muscles in the bottom there, they become irritated. And so now that can lead to things like your painful sex. That can lead to things like painful movement because, oh, I do this and I have this sharp stabbing pain, or I do this, or I try to exercise and this happened. You've got the scar right along the muscle wall of your abdomen. So the abdominal muscles, how is that impacting your posture? How is that impacting your ability to move, to do your job, to work out, to chase your children, right? Because Lord knows they don't stay little forever, and you blink and then they start toddling. And now you feel like you're a whole like Olympian because you got to run all over the place. But how does it feel when you try to do those things? And again, if you have a lot of restrictions, it makes those things extremely difficult and potentially extremely painful as well.
Right. Exactly. So one of the questions, I put a question box up in my my IG stories, and one of the questions that someone had was the type of scar that they have, whether it's depressed or if it's raised. Is that like an indication of more scarring or more pain? Like, is there an indication of anything? That was one of the questions.
So not necessarily. So a raised scar or hypertrophic scar, we know that there is a lot of scar tissue under there. We know that there may be adhesions and whatnot. But even if it's not raised, one of the things that is the tissue mobility. If I go along the scar, can I move the tissue? Does it move? And sometimes you may do that and nothing. It's like, and you hit a wall. It's not moving. The tissue above it's not moving. The tissue below it is not moving, but it's not necessarily raised. The other thing is, when we look at where the scar is, we also have to recognize that there are a lot of superficial nerve endings in that area. So now, how is the sensitivity? There are a lot of people years out who have no sensation at all in the vicinity of their scar. So the other thing too, not just dealing with the appearance of the scar, is what is the sensation like? Is the scar still sensitive? And this is also beyond it being actually healed. So where it's not open anymore. It's sensitive. Am I having pain? You might have pain on one side of the scar, but not on the other side of the scar. You might have pain if you just brush it lightly, like with a cotton ball or your finger or something like that. You might, when you try to touch it with a little pressure, like you go lean against something or you put on some jeans and it's like, that doesn't feel good. And now, right? Or you may have no sensation at all. Like it may be completely numb because those a lot of onto the nerve endings as well. And so now we're having issues there. So short answer, just because it is not raised does not mean that we don't have scar tissue.
Right. Exactly. Yeah. And sometimes that scar tissue can actually push it out, like make it that it's, in some people it pulls it in, so you can have the depressed scar because it's basically pulling that actual scar inward as well. Yep. Okay, let me see what there's, and as you all are coming in, if you all have any questions, and so I know that I think the title, I don't know if it completely shows for everyone, but we're talking about the link between C-section scar, back pain, pelvic floor dysfunction. And so if you all have questions, definitely hit the question bubble below and we'll make sure that we get to it. So right now I'm addressing the questions that were put into the actual DMs. So let's see here. Right, so someone asked, is basic scar massage, so when we talk about basic scar massage, so if you follow me on IG, you've probably seen where we talk about doing circles and we're doing like pinch and lift, so mostly superficial, some of it's a little bit deeper, but when we're talking about like adhesed organs, when we're talking about the bladder being attached to things and things like that deeper scar tissue, is superficial scar tissue enough or should I have surgery? That was one of the questions someone had.
It depends on what your symptoms are. So surgery is never we're never going to say, you know, off the bat, just go have surgery, right? I always will tell people, start off by getting some manual therapy and seeing how that feels. Oftentimes it resolves a lot of the symptoms. We oftentimes will start superficially because that's all people can tolerate. I mean, I've dealt with scars that are decade old and you know, they couldn't even stand so much as a Q-tip on the scar. So sometimes it's really priming the tissues. And it's not so much just the tissues immediately at the scar, but even the entire abdominal wall. Because now other tissues around are going to start compensating for these restrictions. And then we have to make sure that the organs are moving the way that they should. Do we have good mobility throughout the bowels? Do we have good mobility throughout the bladder? Do we have good uterine mobility? So we really want to make sure, first and foremost, we address the superficial layer of tissues. Individuals acclimated to touch, get them acclimate, desensitize the area so that it's not just causing them a whole bunch of grief, and then progressing to deeper layers as we can to try to see, and realistically, I mean, even with the research out there, how deep can we go? I mean, it's deeper than just surface level for sure, but we know about the manual therapy, it does give some neurophysiologic benefits, and this is why we end up getting all the benefits that we can get with scar mobilization, visceral mobilization, all those types of things. So we want somebody who knows what going on and who knows how to address that.
That's what I was going to end with, is that, you know, start with, especially if your concerns are more deeper than superficial, work with a pelvic floor physical therapist, you know, because you don't know, the lay person doesn't know where their organs are in their body. So just to go poking in and just pushing on things, you know, and hoping that they can make it better on their own, that would not be something I would advise. And pretty much you said the same thing. So definitely see a pelvic floor physical therapist if you feel like, you know, these restrictions are affecting my causing the urinary incontinence, the back pain and things like that. And also I would like to note this. So we talk a lot about direct scar tissue massage, but there's also indirect, and that's something that you can do within a few weeks after you have your C-section. And that's something that can be very beneficial with reducing the back pain, especially because then you can actually massage the back, do skin roots rolling to the back. You can address the tightness in the back, because that's very common just from having like the pregnancy posture, as I like to call it, where you're pretty much really, the muscles are shortened, and as you put weakened as well, but those muscles can be shortened, so you want to get in there and get that fascia and just roll that area out. So that can also help with the back pain. But then if you have tightness, and this generally is more so probably months and years down the road, but that tightness is just there, then you'll start to get those compensations in the back. And if you joined in later, that's kind of what we talked about in the beginning. So you want to be able to do both indirect things like stretching, do skin rolling, breathing, diaphragmatic breathing. Those things can be very beneficial as well. It doesn't always have to be hands-on, especially if you can't tolerate it or you haven't been cleared by your doctor for the actual scar massage. So it's very important that you make sure that you get cleared by your doctor, don't have infections. So I want you to think that if you have these things, just go in there and start grabbing on things and, you know, doing it really hard. Like you said, even if it's been years down the road, you may need to have like a gentle type of approach to your scar massage.
And
So I want to make sure that.
Earth, one of the things that, if you've had a cesarean, stand against a wall or stand against a dresser, depending on how tall you are, and just lean back so that you get a little bit of a stretch to your abdominal wall. And every day, spend some time standing with your back against the wall, feet a little bit off the wall, maybe like a foot off the wall, and working on some breathing. Because what that does is it puts you in a little bit of extension at your back, which stretches, gives a gentle stretch to the abdominal wall. And it's an easy way for you to get early on some indirect mobility to the tissues on the front of that abdominal wall, whereby you don't have to go in there and do any poking, prodding, any of that sort of stuff.
Now, I really like this question. I know endometriosis is definitely something you love educating about, and for some moms, it can be debilitating in some ways. So I think I had a mom who had a C-section and endometriosis, and she wanted to know how that may affect her healing or the amount of pain that she may be experiencing.
So one of the things that they're finding with endometriosis is that there can be proliferation or of the endo through uterine incisions. So endo grows on the outside of the uterus, right? It's tissue that is similar to, it's like, but it's not the endometrial lining. And it's on the outside of the uterus, which is why, y'all, hysterectomies don't cure endo. It's my soapbox. Okay, so now, if we have a uterine incision, we have now the potential, especially if you're dealing with, because not all OBs are familiar with or have the additional training necessary to spot endometriosis. Mm-hmm. And if a cesarean is done and we have endometriosis within the pelvic cavity, there can be some transference of those endometrial lesions and cells, so that when the uterus is sutured, it is now within that uterine muscle wall. And for some people, this is how they end up with things like adenomyosis. Mm-hmm. Because now you've got that infiltration, you know, just indirectly of the uterine muscle wall with mm-hmm. that. And so that's how that can be problematic. So could they have more pain? They absolutely can. It's not a hard and fast that because you have endo, you're going to have more pain with a scar, but you also have to understand everyone with endo has different symptoms. They may not all present the same. If prior to your pregnancy and during pregnancy, for a lot of people, their symptoms tend to decrease somewhat, but if before before pregnancy, you are highly symptomatic, lots of pain, doubled over all the things, right? We're dealing with a significant amount of inflammation in and around the pelvic cavity. Now you have a surgery, which any surgical procedure, also inflammation, well,
yeah.
things as a part of that healing, you're going to have similar symptoms. You may still have a lot of those similar symptoms. Is it endo? Not necessarily, but those symptoms are very similar. And unless we are addressing those tissues and addressing what's happening with you and your endo symptoms, you can have those symptoms just perpetuated and extended over a longer period of time. So it is quite possible.
Yeah. So I definitely encourage moms, like if you have endometriosis, you know, and you have a C-section scar, seeing someone like Dr. Juan Martin, where they specialize in both. Because not everybody, I can say that's not my area of expertise, right? And so it's important for you to have someone that understands that and can help you in both areas. And I'm sure that's probably a rarity. But if you can always vet your pelvic PTs and ask them, you know, is that something that you specialize in? If not, is there someone that you know that does? Because I feel like that's just a different beast, right? It's more than one thing. And a lot of times most patients do present with multiple things, but if you can have someone that can help you with both and understand both, that can be very helpful. All right. So we are getting close on time, guys. So if you are here and you have had a C-section, you have questions for us, we're specifically talking about how your C-section scar can be linked to back pain, pelvic floor dysfunction. So if you're just coming in, you probably missed a good bit of the thousands of gems that I think was just thrown into this live. But if you have any specific questions, like you have a C-section, you're having pain with exercise, you're having pain in your back or things like that, if you have questions, definitely feel free to jump in the bubble. There will be a replay of this, so definitely shoot me a DM if you would like to get a replay of this information. But otherwise, I think we had one more question that I had, and then we're going to wrap it up. And let me make sure we actually touched on it, so let me see here. Is there anything else that you wanted to say or that you wanted to touch on that we didn't touch on?
You know, no, not so much. One of the things that that I also tell people is there are a lot of people for whom a cesarean birth feels like a failure. And I think it's something that needs to be said, especially in a society that is highly regarding of aesthetics, right? There are reasons for cesareans to be done in the first place. There are reasons, medical reasons, again, safety of mom, safety of baby, other medical issues that oftentimes, you know, you can go through pregnancy completely healthy and then you get to 38 weeks and something just pops up and it's like, nope, we got to do a C-section. Things like preeclampsia, health syndrome, all those things. So there is the potential for you, even though you have had a wonderful and pretty much, you know, non-eventful pregnancy, to have a cesarean. And one of the things that I've found a lot over the years is there are people who tend to dissociate from their body because that wasn't what they wanted, and or because they truly had a traumatic experience. And so now it is almost as though that part of the body does not exist. And for those individuals especially, I usually will tell them, start by just put a towel on your tummy and just lay your hands on it, right? Bless you. If you don't want to touch your skin, just lay your hands on top of the towel. And every day, take a layer away. So take the towel away, then take the shirt away, and just get to, you can get skin to skin and you can be comfortable. Because that is also a part of healing, acknowledging and being able to kind of reconcile that event and that experience is also a part of the healing process. Healing isn't only physical, especially when it comes to cesarean scars. So just want to put.
I think that's very, very important, right? And definitely the main piece is that it's not just physical healing, right? You can have back pain just from tension and being just so, you know, I mean, stress. I mean, there's so many different things that come with having a baby, giving birth. There's so many physical changes, emotional changes, mental changes, and all of those things need to be addressed, right? And so my main thing is don't ignore it. whether it's an emotional response, whether it's a physical change, like don't ignore it, especially if it's related to pain and your body's telling you, you know, this needs to be addressed, or the fact that you just emotionally are not ready to touch my scar. I'm emotionally, I don't even want to do, like, acknowledge those things and then find ways, like you said, just touching it, looking at it in the mirror, looking at the scar, acknowledging that it's even there, and then gradually working yourself up to scar massage. But, you know, from our end, from a rehab standpoint, we see where not touching the scar for years or not doing anything, it doesn't just go away, right? These symptoms are not going to just go away. There's moms, women who have these symptoms 20, 30 years later in our DMs all the time, in your clinic all the time. You know, is it too late for me, right? And it is never too late, but if you can get on it in the beginning and try to reduce the other things that can happen, you know, down the line, and compensations that can happen down the line, great. And sometimes it just starts with, like you said, just touching it, desensitizing it, doing it in a gentle manner, so that you can hopefully prevent some of these issues. And if you can't prevent it, it can still be treated. Yeah. Very good. I don't think I missed any questions, so thank you guys. Let me see here. No, I don't see any questions, so thank you guys for joining us live. Thank you so much. Let them know where they can find you, all of that good stuff. For those who may be in the area, let them know.
Yeah, so you can find me on Instagram. If you go to the link in my bio, all of my information is there at the Pelvic Perspective. You can find me in Metro Atlanta area. My practice is located in Duluth, Georgia. www.jmmhealthsolutions.com. I also will do mobile visits for those at least within a 20-mile radius of our practice. So I typically tend to do in-home visits for a lot of our pregnant and postpartum mamas, because Lord knows y'all don't need to be out and about in these streets. So
right.
But you also are welcome to come into the office. And if you're not in Metro Atlanta, and you're in Barbados,
hey Barbados.
If you're in Barbados and you need me, then you can also work with me virtually or wherever you are in the world, or in the US, wherever you're at. You know, I'm happy to work with you virtually as well. So yeah, there are lots of different ways to connect.
Absolutely. And then, of course, you guys know I do virtual as well as C-section education, and also have my C-section guide. And Dr. Juan, you also have a C-section guide as well. So the resources are there, mamas, right? At the end of the day, we want you feeling better, moving better. Yeah, and just know that, you know, it's not the end of the world, that type of thing, right? There's so many solutions. There's so much help for you. We're definitely there. And then if we're not able to help you, we will definitely try to send you to someone who can. All right. Thank you guys so much. Thank you for joining us. And we'll talk to you soon.
Bye, y'all.
Bye.